Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Aultman Health System. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Trisha Witts, Sales Supervisor with Aultman's PrimeTime Health Plan. Good morning, Trisha, and welcome to the show.
Good morning. Thank you for having me. I can't believe it's been a year already,
Hmm.
and we're back at it.
Yeah.
All right. Well, Medicare's annual open enrollment period runs through December 7th, 2025. This is the time to enroll in new plans, change existing plans, or to switch between original Medicare to an Advantage plan or vice versa. So we'd like to remind our listeners today our program is also available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe to our program.
So, Tricia, tell us about yourself and what you do with Primetime Health Plan.
Oh, certainly. Well, I've been with the organization for 28 years. And for the last 27 years, I've been in the Medicare field. I have, throughout my time here, had the privilege of leading a devoted sales team. They're wonderful. I've also had the privilege to educate our community about Medicare and many options that are available to them. My favorite thing about my work is just helping people truly understand what their healthcare choices are. I feel that it empowers them to be able to make that decision based on what their needs are. And I'm just glad to be here today to share information I've learned over the years, hopefully to clarify some things for our community.
During this time of year, we hear a lot about AEP. What is AEP when it comes to Medicare plans?
So AEP is the acronym for Annual Election Period. And that is the time frame that Medicare allows for Medicare recipients to make changes to their plan. That time frame begins October 15th through December 7th. And those changes that they make, whether it's to go back to original Medicare and pick up a supplemental plan, to change their prescription drug program, or to another Medicare Advantage plan, those changes do take effect January 1st.
Okay, what type of changes do beneficiaries make during AEP?
So the beneficiaries, as mentioned, they have the ability to compare their Medicare Advantage plans with the carriers that they're currently with. Typically, they will receive an annual notice of change from the carrier by the end of September. And that outlines what their plan is currently, what it changes to. And if they're happy with that, they don't need to make changes, but it allows them the opportunity to look at other plan options, whether it's within the same carrier or looking at a different carrier, going back to original Medicare, picking up a prescription drug program. They are allowed to make all of those changes during this time frame.
Okay. What happens if someone misses the time frame?
That's a good question. So Medicare, this is pertaining to those who have Medicare Advantage only. January 1st to March 31st, they give one more opportunity for Medicare recipients to make a change. And what that looks like is they're able to go from one Medicare Advantage plan to another. They can change within the same carrier that they're with, or they can go back to original Medicare and pick up a prescription Part D.
Okay. So, what if I'm happy with the plan I have? Do I need to do anything?
No, absolutely not. That's what those annual notice of changes are for, so they can review the outline of what the changes are solely, and they just don't need to do anything. The only time, and this has happened quite a bit this year for the first time in a while, is if the carrier reaches out to the member by mail, letting them know that the plan that they have currently is going to terminate. So they would have to
Hmm.
search for something else.
Hmm. So, why is it important to review plan options?
Every year, the plans make changes, and that could be to the formulary, which is a list of medications. Some of the medications go from tier two to tier one, or maybe they go to tier one to tier two, and that's typically a generic medication. Some medications actually are removed from the formulary, so they need to double check that as well. They increase premiums, max out of pockets are changed. benefit copays are changed. So it's really important based on the year that you've had with your health. Maybe you're visiting the doctor more often than you had been in the past, or maybe not so much. So there's always room for improvement for yourself and through the plan options. So you just want to double check everything.
So I know there are different types of Medicare plans out there. Can you explain the difference between a Medicare supplement plan versus a Medicare Advantage plan?
Absolutely. So with the Medicare supplement plan and the Advantage plan, the way we at PrimeTime like to describe this is that there's option one and there's option two. So if you can visualize under option one, three separate entities, and we present it this way, there's three separate boxes. The first box means that it's Medicare A, which is hospitalization, and Medicare Part B, which is for outpatient services. That would be doctor office visits, emergency room, physical speech therapy, in and out. In addition to that, Medicare supplements pay secondary to the Medicare. So they're showing both cards to the doctors, to the hospitals as they're utilizing it. Supplemental plans are identified from letters A through N. I will say the most utilized plan is Plan G as in George. Plan G is in George, typically, generally speaking, for someone who's 65 is about $165 a month, in addition to what they pay for their Medicare Part B. And that can be different based on income. That's a whole different conversation, but we're glad to have it. But Plan G, what you're responsible for on that plan is the Part B deductible, which is $257 for 2025. 2026 hasn't been released yet, and that's for outpatient services. So if they go to the doctor, they have some lab work, maybe there's an x-ray, they're going to pay those costs until they reach the $257 amount. Once that's met, any Medicare covered service, they pick up what Medicare doesn't cover. Okay, so inpatient hospitalization is covered at 100%. The remainder of the 20% that Medicare doesn't cover for outpatient services are picked up. Plan G also gives you some out of area coverage and different, travel out of the country. Okay, so there's some limited there, but other plans don't offer that. So that is one that does. With that, they do not cover prescription drugs. So that's where a Part D prescription standalone plan comes into play. Again, three separate entities. So they would have under option one, the ability to have Medicare, supplement, and prescription drugs. One of the things about the supplemental plan too that's so popular is that typically they allow you to utilize any physician, any hospital across the United States without having any type of an approval. Now, there are some plans out there that are considered to be select plans, which means you have a network to stay within, but the majority of the supplemental plans don't. So people like that flexibility. Okay, so that's option one, three separate entities. And then you have option two, which are Medicare Advantage plans. And Medicare Advantage plans are subsidized directly with Medicare. And as a result, those plans are under contract every single year. They have to be renewed. But if a Medicare recipient joins an Advantage plan, Medicare starts to subsidize that plan on their behalf. So while they never lose Medicare, they're just behind the scenes working with the carrier to provide benefits. And that carrier becomes the only insurance that that member has for the time that they're with it. And it's one card, one-stop shopping. It covers the prescription drugs. They have some additional benefits, which we'll talk about. But with that, it's an easier, less expensive option, I would say, because of the subsidy. You have plan premiums that start at $0 a month, and then they go on up depending on the plan that they choose.
You may have already answered part of this. What is the benefit of having an Advantage plan over original Medicare A and B?
So when it comes to original Medicare A and B, there are some deductibles for the inpatient hospitalization, and there are copays that are associated depending on the date and the time frame that they're within the hospital. There's the deductible for the Part B services, as well as the Medicare recipient being responsible for 20% of the claims thereafter. When it comes to Medicare Advantage plans, right up front as you are shopping, you can look at the plan design and see that there's a max out of pocket, which means it's a stop loss to the Medicare beneficiary. They will know that if something catastrophic happens, what their total amount will be out of pocket upfront based on their copays, co-insurances that they're responsible for as they utilize the plan. So that's one of the major benefits of having an Advantage plan over original Medicare A and B. Some of the other things would be that Medicare Advantage plans, many of them offer some dental, vision benefits. They have hearing, over-the-counter items where members can purchase toothpaste and Band-Aids and Tylenol. And some of them have healthy food options as well, where they can go to the grocery store and pick up fruits and vegetables. So those are why the Advantage plans tend to be a benefit for our Medicare recipients.
Okay, Tricia, it's time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Are you ready for vaccine season? Stop in or schedule your pneumonia, Tdap, or shingles vaccine online at medshoprx.com.
You know, before I ask you my next question, Trisha, I'm kind of impressed with, Medicare, all insurance can be complicated. And sometimes when patients ask us questions at the pharmacy, it's a challenge to try to help guide them. And we usually try to guide them to an agent who is trained and is an expert in this, or, I'm sure you'll share your contact information at the end and they could reach out to your team. But I'm staggered at how low you said the hospitalization deductible is. I guess I just feel like, given how many people on commercial insurance these days are dealing with four-figure deductibles to get coverage, it's really fascinating to me the scope of coverage that Medicare offers. Am I wrong?
No, you're not wrong. When it comes to original Medicare, as mentioned, there are deductibles that are associated with that. And just to give you an example, days 1 through 60 is $1,676. And then it just continues to go up from there based on the days that they're in the hospital. They're pretty extensive, like $419 a day, days 61 through 90. And then beyond that, it's $838 for 2025 from days 91 to 150. So, of course, with the supplemental plan, you are going to pay more in a monthly premium, but it does protect you from those out-of-pocket costs that are potentially there. Um, and that's why it's important this time of year to have these conversations because you can't enroll just at any given time. And you never know when your health is going to change. It happens all the time mid-year, and then they have to have these responsibilities of the co-insurances and deductibles.
Okay. All right. So what happens if the doctor that I want isn't in the plan that I'm looking at?
So when it comes to the Medicare Advantage plans, yes, they typically do have networks that you need to stay within. So it's important to double check with the carriers just to make sure that your doctors and hospitals that you would like to be affiliated with are there and available to you. There are different types of plans as well that you can utilize, whether it's an HMO or PPO plan, which we can talk about. But PrimeTime specifically with our Advantage plan, we have an extensive network offering when it comes to hospitals. We have over 50 hospitals, including Aultman, Cleveland Clinic Mercy, all of Cleveland Clinic's facilities, including Florida, as well as the University Health Systems.
Okay, well, that was going to be my next question. So what if you're traveling and you're on an Advantage plan and you need a hospital? What happens?
So if you are traveling for prime time specifically, I can answer that we do cover urgent and emergency care worldwide. And if for some reason someone is admitted, they would be covered that way as well. They would just have their associated copays.
Hmm. What if I join an Advantage plan and don't like it? Am I stuck with this coverage forever?
Forever is a long time, Paul.
Yeah.
However, you have the annual election period every year from October 15th through December 7th to make changes. And again, from January 1st to March 31st, if you are with a Medicare Advantage plan. So to answer your question, no, you have the flexibility to make changes.
Okay, but that's not throughout the plan that you selected?
It can be. Yeah,
Okay.
absolutely. So, prime time, for instance, we have four different Medicare Advantage plans. So, not only do we send the annual notice of change, but we also send the comparison chart to all of our members every year so they can look at what we have to offer and they can make those changes based on what we send them and what their healthcare needs are for the upcoming year. Obviously, you don't have a crystal ball, but based on what has happened in the past year. So not only do we meet with individuals who are unfamiliar with prime time, but we get our members here every single day in our office face to face to talk about these changes. That's always an
Mhm.
option as well.
Hmm. Okay. When it comes to prescription Part D, what is it exactly?
I feel like I should be asking you that question. So when it comes to the prescription Part D, this was part of the Medicare Act brought out in 2003. Prior to 2006, that's when it was implemented, Medicare recipients were responsible for paying for all their medications 100% out of their pocket. So, what this has allowed, and there's a benefit structure that Medicare has designed, and the prescription drug programs and Medicare Advantage plans that offer prescription drug programs need to follow these guidelines. They have the opportunity to make their plan a little bit more rich than the Medicare Part D plan, but it covers the prescription drugs for our members based on the medications, the tiering system. So that goes back to the formulary, which is a list of medications. Copays are associated for tier ones, tier two, maybe some deductibles for brand name medications, tier three, four, and five. So basically, it's a drug program that's available to the Medicare recipients.
Okay, well, here's another big time Medicare D question. What does it mean to have to find your drug on a formulary?
So it's important just because some medications I have witnessed with the people that I work with. Some of their physicians may only prescribe the brand name of a certain medication versus the generic. And maybe there's a list of medications or the formulary that the carrier has that doesn't cover the brand, but they cover the generic. So with that, they go through a list of all the approved medications according to that carrier and see what tier it is. So that way they can know what their associated copays are when they go to the pharmacy, if there's a deductible, but you want to make sure so there are no surprises that it is covered according to the carrier that you choose, because sometimes they have to go through an approval process. Maybe they are on a brand name and the generic's available and the doctor needs to submit documentation as to why they have to take that brand name. But it's important to have those discussions before January 1st when you go get your medication and there are no surprises.
Okay. Um, let's talk about drug tiers. Can you talk about what drug tiers are and how you're probably going to have one no matter which insurance plan you pick?
Sure. So when it comes to drug tiers, and I want to talk about a little bit to that point, is Medicare, part of the structure is that the Advantage plans and this prescription drug programs need to follow their guidelines in a way of they have to offer at least two medications per classification. So if someone were taking acid reflux medication, Maybe one carrier will cover Protonix and omeprazole, and another carrier covers pantoprazole and Prevacid. Okay, they're the same type of medication in this realm of classification, but they're not required to cover all of them. So, with that being said, there could be some medications that require step therapy or quantity limits based on federal guidelines. So, that's going to determine, and it could be relating to cost as well, where they fall on the formulary. For a PrimeTime example, we have 5 tiers. Tier 1 and Tier 2 are considered generics, preferred and non-preferred generics. And then Tier 3 is a preferred brand name medication. Tier 4 is going to be a non-preferred brand. And then Tier 5 is a specialty tier medication. And those are actually only allotted in a 30-day supply. And I will give you an example. Our Tier 5 medications would be more like an MS medication, like an injection. So those tend to be pretty costly. So it's going to be a higher tier as a result. And yes, all carriers will have a formulary and a tiered system for medications.
Okay, it's the bottom of the hour and time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. You're listening to Health Matters with the Medicine Center Pharmacy. I am your host and pharmacist, Paul White. This morning, we're talking with Trisha Witts, and she is an expert.
All right, let's talk about some stages of prescription Part D plans and how they've changed.
So there's been good news for the Medicare recipients when it comes to the Part D stages. Long before 2025, there was the dreaded conversations about the donut hole or the coverage gap. And because of the Inflation Reduction Act, they have eliminated that. So it's great news. Prior to that, though, with the coverage gap stage, the Medicare recipients were responsible for paying 25% of their medications when they got to the coverage gap or donut hole to up to over $5,000 in the year. But as of 2025, Medicare has changed it to just 3 stages. So there's a deductible stage, and as mentioned, carriers can make their deductible the same as Medicare or less. So it's important to look at that. And some of them only pertain to tier 3, 4, and 5 medications. And then there's the initial coverage stage where this is where the members are paying their co-pays or their co-insurances, but their max out of pocket now is $2,100 for 2026. And if they get to that within the year, then they're covered at 100% for the remainder of the year. So that's far different than the over $5,000 in the past.
So is there any coverage out there that can help with the 2,100 potential out-of-pocket cost under
So
the Part D plan?
unless the members are utilizing the VA as well as maybe a Part D, and many people are just using the Veterans Administration, their costs are typically lower with them. But the only other thing would be through Social Security. There is a program called Extra Help or Low Income Subsidy, and they will help with deductible cost as well as typically give them a set copay amount for generics and brand as well for the entire year, which is much less than some of the tiers could be on the different carrier plans. Other than that, there is help in the way of a Medicare prescription drug payment plan that has been implemented as of 2025. And this is available through all carriers, whoever they choose for their Part D. And it just allows them to break up their payments for the medications throughout the year. So it's not completely overwhelming at one time. And they can definitely talk to their carrier about that and how that works.
So, can you give us examples of coverage of original Medicare versus PrimeTime Health Plan HMO-POS?
Yeah, so as mentioned before, when it comes to Part A under the Medicare plan, that's inpatient. If they were utilizing the hospital as an inpatient, it would be $1,676 when they were admitted from days 1 through 60. And then days 60 through 90 would be a $419 per day copay. And again, keep in mind, this is for 2025. And then the lifetime reserve days, 91 to 150, they would be responsible for $838 per day. When it comes to PrimeTime Health Plan, keep in mind that our max out of pocket on the Plus plan is $4,000 for 2026, which means that in their copays, if they were to reach that, they would be covered at 100% for the remainder of the year. So for the Plus plan, they have a copay for the first 6 days for inpatient hospitalization, and it's $325 a day. And after the 6 day, it's covered at 100%. That would be one example. The next would be the Part B services that we talked about for 2025. They have a $257 deductible on original Medicare, and then they're responsible for 20% of their claims. As we're PrimeTime, there is no, on the Plus plan, there's no $257 deductible that needs to be met. And for instance, if they went to their primary care doctor, they would actually pay $0. A specialist is anywhere from 30 to 40, depending on the plan that they choose. But again, all of the copays and co-insurances that they're responsible for on the Medicare Advantage plan through PrimeTime, they all apply towards a max out of pocket, unlike Medicare.
So, what are some of the benefits of PrimeTime Health Plan, HMO-POS, and that you can get with original Medicare?
The items that you can get through PrimeTime Health Plan that are not available on original Medicare would be dental. We have up to $1,250 in reimbursement. What's nice about that is they can use any dentist that they wish to go to, and the dentist can bill on their behalf or they can submit for reimbursement. They have a $0 eye exam for routine glasses and $300 for eyewear. We have no cost gym memberships through Silver Sneakers. If someone were admitted, we also provide them up to 10 meals once they are discharged that are delivered to their home. We also give them an allowance of $400 to utilize for over-the-counter items or healthy foods. So they get $100 every quarter. And those are items that you just don't have with original Medicare.
Gosh.
Sounds like a
Amazing.
no-brainer, doesn't it, Paul?
Oh my God, it's amazing. It really is.
All right. So what would be a reason that one would switch from a Medicare supplement to a Medicare Advantage plan? And you've probably already given us some tips there, but
Yeah,
framing it that way.
that's a great question. I actually had two clients this week where they are paying over $5,000 a year in just their premium for their Medicare supplement, as well as their prescription Part D plan. Very healthy individuals. So they have changed to come to PrimeTime because the premium can be anywhere from $0 up to $115 a month. And the max out of pocket, the highest one we have is $4,900. So even if they were to meet their max out of pocket, they're still ahead. Not to mention they get all of the extra items like the gym memberships, the over-the-counter, dental, vision, things of that nature. So that's one of the major reasons would be the cost associated with that.
Gosh.
All right. Well, how can the listeners today get more information about PrimeTime on everything that's offered?
They can certainly call our office. Right now through March 31st, we are available for call center hours 8 a.m. to 8 p.m. 7 days a week. That number is 330-363-7407 or 1-800-577-5084. And TTY users should be calling 711. They can visit our website at pthp.com. They can request a brochure. We can send them that information. And again, we're located at the Morrow House, 2600 6th Street. For walk-in hours, 8 a.m. to 8 or 4:30 p.m. Monday through Friday, that they can just stop in and see one of us as well.
Can you give the listeners like a garden variety example if someone would call, what the interaction might be like, what information they might need to have handy? I'm just guessing that there's probably some paperwork they need to have at their fingertips, which would make it go a lot smoother.
So when it comes to discussions based on your individual situation, we do encourage, well, number one, we pride ourselves on the fact that when you call in, you get a live person. Our representatives are the same people that reside in our community, and they would transfer them to the sales department, which would come to myself, Karen, Debbie, Denise. There's several of us here to pick up the phone. And based on their individual needs, we would just suggest that they have their list of physicians. Not that it's necessary, but we'd like to help navigate to make sure and confirm that they are in the network, as well as the hospitals, the pharmacies that they like to use, or would they rather use mail order, as well as their list of medications. And again, not required, but just to help them navigate the best way that we know how to guide them and make sure that what they are needing is available.
Hmm.
I'm sure that at times it's a challenge. I mean, it seems like there's a lot of questions, a lot of variables, but I'm sure you've got a really good system to help people navigate that.
We do. We take pride in our work, and as I mentioned, the team here is very dedicated to helping the community, making the best choice. And if prime time is not the best choice for them, we let them know that as well.
Okay.
You know, the complexity of the Medicare plans is really kind of wild, but compared to what it used to be, it certainly is fantastic. The benefits that they are getting, under most Medicare plans.
Mhm.
But we hear so many, gosh, so many much talk about, oh my gosh, I don't understand this, I don't understand that. And even though it's pretty straightforward and they got it in front of you on a sheet of paper,
Mhm.
but we do spend a lot of time, and it's okay, discussing the plans or plans with them. So,
Well, to that point, I just like to mention that outside of our team selling prime time or reviewing those plans with our current members, we do also provide general Medicare education. And we don't do it during this time frame because the focus is getting people where they need to be for January. But every year between January through September, we have the Medicare education seminars within the community. We do them online. We have recorded videos online as well. So it's not just about prime time. We have that ability to educate them on other options,
okay,
not carriers, but the same type of information we're going over today so they have a better understanding.
okay. Okay, and it's time for our final break. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thank you for joining us. Let's get back to the last segment of the show.
All right, Trisha, for listeners just joining us, I think it's important that maybe you could you give us a summary of what's going on for what's new in 2026 for Medicare plans in general, any changes from 2025, and what people might want to look for if they're thinking about sticking with their same plan that might surprise them.
Absolutely. So, as mentioned, it's encouraged to review your annual notice of change. I will say this year seems like there's more changes than there have been in the recent past. Some carriers are actually leaving certain areas, so look for those letters to make sure. Just open the mail if it comes to you to make sure that you're not one of those recipients that have to definitely look for another plan. But there are changes with the prescription drug programs, I think. The deductibles are much higher. The tierings have changed quite a bit, so double check with that. And some of the additional benefits that people really appreciate, the over-the-counter items, some of those have changed as well as their silver sneakers or silver and fit programs. So things that are important to you as a Medicare recipient or an Advantage member, review those. Go to the carrier, talk to the broker, any agent that you're comfortable with, and make sure that you're still on the appropriate plan. Because there's always changes, but this year seemingly there's more than normal, I would say.
Okay. Very good. One thing that I did want to mention that we had a question come in on was, at one of the breaks, there was a commercial about our Health Matters membership savings program. And we do have a cost plus generic savings program for patients. And it can work with your commercial insurance or a Medicare D plan, depending on your drug mix. Trisha's mentioned earlier today about different things with respect to your drug formulary. And everybody's a little unique with respect to what they take. Maybe you have something for blood pressure, maybe you have something for cholesterol, maybe you have something kind of totally different. But there are opportunities sometimes, depending on the insurance plan and the drug and the formulary, where our Health Matters membership program might make a difference. And what that just means simply is if you ask one of our pharmacy staff about what your price would be on our membership program, we can help you compare it to what your copay would be for your insurance. So, maybe if you have a $25 copay for a particular generic medication that might not be on a preferred tier or whatever, there might be an opportunity for you to get a 90 or 120-day supply on a membership program for a lower price than that. So it's something that you can do to have a conversation. It is a complement to your normal plan. We have patients with and without insurance that join our Health Matters membership program. So it really just depends on your particular drug mix. One example that works well with our Health Matters membership generic drug savings program is patients on commercial plans that have really high deductibles. So if they have like an HSA account, and you mentioned a family earlier that was very healthy and had a pretty high Medicare B and supplement fee. If you're a 20-something and you're pretty healthy, but you take a couple medications and you have this $5,000 or $6,000 deductible on your insurance, you're going to pay full price anyway. It's really worth your while to compare what your price might be on a membership program like ours. So, I also wanted to touch on. We've talked about how to sign up for PrimeTime. We talked about phone numbers. You mentioned some recorded programming or some other educational opportunities. Is that on your PrimeTime or AllCare website? Where can people find that information?
That would be on our website, thepthp.com, or they can call in and we can direct them to where those would be and sign them up.
Okay.
Mhm.
And how about do you have a story about a patient interaction that surprised them based on what Medicare could do for them when maybe they didn't realize that, maybe they've always had commercial insurance and, you get kind of used to how those things work. Well, you try to, but do you have an example maybe that pops out where people felt like they had kind of their lives simplified by switching to Medicare? Is that a fair question?
I think it's more of a fair question in this day and age than it would have been in the past, because in the past, the health insurance deductibles and things weren't necessarily so high. So they are changing. Okay. And when they come over to the Medicare side of things, the only sticker shock that we had in the past was more about the medications. Because again, when they were working prior to 2006 and they came to prime time or Medicare and they didn't have drug coverage, that was sticker shock. But now things are kind of evening out where they think, well, I don't have a deductible and I have these copays, which I'm used to. So I think they're feeling pretty at ease coming over to Medicare sometimes, especially on the individual side, which is for those who are under 65 but don't have an employer plan, and they have very high deductibles. So they look forward to turning 65 at that point.
Yes. You know, in looking at these programs compared to how things were years ago, they're really bargains. I started as a pharmacist years ago when there were limited amounts of drugs in each category. And
Hmm.
now we have many pharmaceuticals in many of the categories that are very expensive.
Hmm.
And putting those into the Medicare uh, system really has been helpful and very healthful. Okay.
Hmm.
Because there's so many drugs out there compared to when I started as a pharmacist back in the late 1700s. So
Yeah, and you're right. And I know that it seems overwhelming sometimes with the cost, which is nice that you have that program as well to look into. But I can give you an example, personal experience of just my mom who, if she wouldn't have had a Part D plan in place, as mentioned, you can't just enroll at any time. It was mid-year, it was summertime, and she started having heart issues. And so she was prescribed Eliquis. And it's
Mhm.
just important because had she not had that Part D, then she would have had to pay for Eliquis out of pocket.
Mm.
So that's another story as to why it's important to look at those options. And I understand it seems overwhelming cost-wise at times, but it would be more overwhelming if you didn't have a plan in place.
And I have a compliment to your story also about Eliquis. I know of a patient in one of our locations who was not covered by any insurance and has just kind of gone with the flow for about 20 years. And they got prescribed Eliquis this year and had a wake up call because, at 600 a month, it adds up fast.
It does.
And of course, that isn't even including the hospitalization and all the other things. So, when it's one thing if you go from, like, there's no penalty if you go from commercial insurance today to Medicare January 1st, right?
Yeah.
But if you have that gap, then they kind of like life insurance, they raise your premium and hit you for a higher fee. But so she's navigating that process, but you know, we all think we're going to live forever and be healthy, but sometimes we get surprised. So
Mhm.
better off to be prepared, right?
Yes, and that's a great point, Brad, because if you don't sign up for a prescription drug program when you're first eligible, and then you sign up years later, there's a penalty that is added up based on the amount of years that you were not involved in a Part D plan, and they take that total and they tack it on to your plan premium, and it just goes with you the rest of your life. There's no way of getting around that. So it is important.
Well,
I want to throw something else out here. They are going to repeat this program on Sunday, Sunday morning, 10:30 to 11:30. So you get a chance to listen to your own program. Okay.
Oh, awesome.
So, and we did this because Aultman Health System sponsors this program.
We
And th
appreciate that.
and this is a very good program for an awful lot of people. What we talked about today and the way we talked about it was clear, and not complicated. So that's
We
really good.
always appreciate the opportunity. We thank you so much for having us.
Well,
how
Altman has.
about one last time to hit everybody up for phone numbers for more information and how to get in touch with you and your team?
Sure. PrimeTime Health Plan, 2600 Morrow House. It's 6th Street, Southwest, Canton, 44710, or 330-363-7407, or 1-800-577-5084, TTY 711. That's until March 31st, 7 days a week from 8 a.m. to 8 p.m. for the customer service call center. And then walk-in hours are Monday through Friday, 8 to 4:30.
Hmm, very interesting. Okay. Thank you to our guest, Trisha Witts. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Altman Health System and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC. And thank you very much, Tricia.
Thank you.
It was very interesting. Okay.
Thank you very much. Appreciate you.
Yeah, thank you.
Have a
Hope
good
you
day.
guys, you too.
Thank you.
Bye.
Bye-bye.